Partnership saying the agreement will strengthen Kenya's health system. And as Elizabeth Atieno now reports, the U.S. Embassy has maintained that the cooperation framework is not alone.
For more than 25 years, the United States has invested $7 billion into Kenya's health system in a bid to prevent the spread of TB, HIV, and malaria. And on Thursday this week, Kenya became the first country to sign the historic health cooperation framework, with the U.S. government investing 208 billion Kenya shillings into the agreement. The U.S. government has maintained that although the investment is not alone, the government of Kenya should ensure there is accountability. Additionally, the government of Kenya has committed to increase domestic health spending by $850 million within the 5 years.
I assure you that every shilling and every dollar will be spent efficiently, effectively, and accountably.
And as we go forward with the implementation discussion, certainly accountability and making sure that the money that the American people invest in Kenya's health system is spent wisely and effectively.
It's not a loan, so it is a continuing assistance. So this is money that we're putting forward. We don't expect to be paid back unless there's something that goes wrong.
The new model replaces fragmented donor-led arrangements with a government-to-government G2G funding approach, whereby government systems like SHA, KEMSA, IFMIS, the Ministry of Health, the Digital Health Agency, and the Kenya National Public Health Institute are expected to benefit from the direct funding. This, however, raises a question on the fate of non-governmental organizations.
Part of this is also there's a faith-based initiative to try to look at, there's a lot of local partners that we've worked with over the last few years, and we want to make sure that we're continuing to build them up so that they can also work through this transition and to be able to be sustainable in the long run.
Another serious concern raised by Kenyans is data privacy. The U.S. Embassy in Nairobi has maintained that the data sharing agreement will ensure that all data shared is for purposes of implementation of the cooperation framework and will strictly adhere to the Data Protection Act of 2019, the Digital Health Act of 2023, and all other applicable Kenyan laws and regulations.
There's some misperceptions and misinformation about a data sharing agreement. So we just wanted to clarify. We've had existing data agreements with the government of Kenya, and the government of Kenya in this new agreement will, as it has always, continue to abide by the privacy laws.
The government of Kenya is expected to gradually take over U.S. government-funded health commodities and human resources for health by 2031. Additionally, the government is expected to absorb 515 laboratory workers and 13,293 healthcare workers by 2028. Elizabeth Atieno, TV 47, Nairobi.